severest cases of FGM, less than 3% of the clitoris is actually removed. So that means 97% of it is there beneath the skin, beneath the scar tissue, and this is the surgery. We bring that to the surface and women regain sexual function. I'm proud to say we've operated on nearly 500 patients thus far. Many more to come, of course. I'm proud of it, but I'm also sad that I can't do more with my time. And this is why it's so important to amplify the resources that women have. This is what we did in Burkina Faso in 2016. It's what we did in Nairobi in 2017, and what we hope to do here in 2019. This mission coming up to Kenya, there will be a surgeon from Calgary, Alberta, where as you know, Canada has a large number of women, and there's no physician, no surgeon offering clitoral restoration. There are also 2 surgeons from Australia coming. And in Australia as well, there are many immigrants, African immigrants, who have been affected by FGM. No surgeons there to offer clitoral restoration. And of course, Kenya, where prior to 2017, there were no surgeons that could do the procedure. We were able to teach more than half of Kenya's plastic surgeons the technique of clitoral restoration. And several of those now have continued on. I was approached in 2007 by Nadine Gary, the international director, with endless devotion to this topic. She approached me and asked if I would be willing to learn from the founder of the procedure, the pioneer, Dr. Pierre Foldes, who had traveled to primarily Burkina Faso at the time in the 1980s and had observed this problem going on. And he asked the question, why are we not interested in the women's sexual function, and what can we do about that? And so he developed a technique where we can bring the clitoris to the surface and restore function, clitoral, sensory function to women. There is an astounding lack of knowledge about clitoral anatomy. When it's mapped out, the clitoris is more than 11 centimeters. And so we know even in the severest cases of FGM, less than 3% of the clitoris is actually removed. So that means 97% of it is there beneath the skin, beneath the scar tissue, and this is the surgery. We bring that to the surface and women regain sexual function.